so far as you have a healthy smile and the teeth has its natural color, you are fine. So we move on to dental caries. And this, I have a beautiful chart here, which actually shows the stages of caries. So you have a healthy tooth, then an incipient cavity, then it keeps going on. So for the first 3 stages, most patients will say it's not painful, so they will never visit, they won't come. And then even when it gets painful, they start doing they have a lot of local dentists to give them instructions until it gets to this stage, and then you see them very early. They walk to the dentist at dawn. They start talking to anyone in white coats because they couldn't sleep. Yes, dental pain starts at night, usually at dawn. It will destroy your sleep if you don't attend to it. So dental caries, also known as tooth decay, is a multifactorial microbial infectious disease characterized by demineralization of inorganic structure and then the destruction of the organic substance of tooth. So the tooth basically has 2 components, the inorganic and the organic. It demineralizes the inorganic structure, so it becomes brittle and soft and starts coming off. And then the organic substance, it destroys it. So you have that big hole in it. So, and the microbial aspect is not because you are taking sugar or you are taking toffee, so you have caries, as our mothers made us aware. So if you eat a lot of toffee, you get caries, tooth decay. No, you, first of all, you need, so this is what dental caries is about. It's not because of your diet, and it's not because you have bacteria in your mouth, and it's not because you have teeth in your mouth, and it's not because of the environmental factors leading to your poor oral hygiene. It is a combination of all these factors that results in dental caries. So you should have a tooth in your mouth, so you don't have someone without teeth complaining of tooth decay or dental care. You should have teeth in your mouth. And you should have, whether you like it or not, you have some kind of normal flora in your mouth. Strep's mutans is always in your mouth. You have tartar in your mouth so far as you eat. And you have these organisms in your mouth. Even if you clean and clean, you still have some form of normal flora, which is always there. So you have it in your mouth. Then the kind of diet we take. So the sucrose, glucose, and fructose are able to, the bacteria works on it. So anytime you have these carbohydrate diets, so it is carbohydrate. It is not just the sugars. It's not just the toffees. We have a lot of foods containing carbohydrates. Any food that breaks down to glucose has the potential of causing tooth decay. So you have patients walking to you and saying, I don't eat toffees, but I have tooth decay. No, it is carbohydrates. And the frequency of taking it, so is the time. Every 5 minutes you go on to snacking. You keep snacking every 5 minutes, every 2 minutes. You, after eating, spouse watching TV, you start eating chocolates, you start taking a lot of sweets in between. So patients who snack a lot tend to have these cavities. And then poor oral hygiene. And so if you have very low fluoride exposure, you have certain enamel defects in your teeth and things, you are prone to these cavities than the ordinary patient with healthy teeth. So it is a combination of all these factors that brings about the cavity. So this is just the role of carbohydrates, microorganisms, the acids, and the dental plaque. That's it. So with the tooth decay, we have it in stages. You have when it's just in enamel, and even if it's advanced, a little advanced in enamel, it's still not painful. And at this particular stage, you just see a discoloration, a white spot on your enamel. So sometimes it looks a little brown, but it's really not painful. So you won't come. And that's why we advise that at least every year, visit the dentist. When we pick it at this stage, we just do a usual filling for you at this very stage. Then This stage 2, we do the normal dental filling. So you have our composite restoration, amalgam restoration. I'll show you pictures of that. Then when it gets into dentine, that is when it becomes painful. But this kind of pain is intermittent. So whilst chewing, food enters there and you hold your jaw. It's so painful. And as soon as you get your toothpick to pick out the food, you feel a little better. And most patients, as stubborn as we are, will avoid chewing on that side. As soon as you avoid chewing on that side, it becomes a recipe for disaster, because the caries will progress faster than it should. And caries in dentin progresses very fast. So it progresses as fast as it can. And then it goes into the pulp where the blood vessels and nerve supplies are. And at this stage, it gives you sleepless nights. At this stage, you feel the pain in your ear. You feel the pain in areas where you don't even assume is coming from your tooth. And that is when we run to the dentist. But unfortunately, here you have only 2 options: to do the root canal treatment. Even with the root canal treatment, it depends on the structure of the teeth at presentation, or the other option is to extract the tooth, take the tooth out. So for the incipient lesions, when it's just a spot on the enamel, we give you oral hygiene instructions. We make sure you reinforce that, and then we review the patient, and the tooth is. It works as soon as you reinforce your oral hygiene. It remineralizes on its own. Then we do our dental restoration. So that's an amalgam restoration, neatly done in the patient's mouth. This is also a type of restoration, composite restoration. So after composite restoration, you don't even see the tooth looks so beautiful. So most patients would want the composite restoration, but I must say amalgam is very good and strong as well. Then we do for the damaged teeth, when it gets to the pulp, we do our root canal treatment. After root canal treatment, you have to crown the tooth or put in an onlay. Sometimes the cavity destroys the tooth completely, but we try to salvage it. So we put large fillings on it, and these are the preformed onlays and inlays. So we put them in. Then the other option is to take out the tooth and replace them. Sorry for the break. So a patient will say, why not? I'll just take out my tooth and replace it. Please, it is not cheap to replace. It is not cheap. It's very expensive. And some will say, I'll leave it like that. So this is the normal anatomy of a patient. Then when you move to the next, patient has lost a number of posterior teeth. You start getting bone loss. So you look older than you ordinarily would look. You look quite older than your age. And then when you have complete tooth loss, this is how you look. And replacing a missing tooth is quite expensive. An implant is like $1,500 to $2,000 now. Bridges and crowns are now $6,000, $9,000. Even a crown is $2,000. So let's try to maintain and prevent these cavities as much as we can. What are the complications of tooth decay? So if you have it and you have the persistent pains, you won't come. You have spreading infection. So from the initial picture, you notice it's actually spreading to the local spread to the bone. So it spreads to the bone, and still you don't do anything. You put in some, go straight to understand that they actually put in painkillers in the cavity. Fine, you think you have a lot of toothache, you will come. It starts spreading to distant tissues. So you have it spreading along the fascial spaces. You come with necrotizing fasciitis, noma, you have oral abscess, and eventually respiratory complications, because this swelling will obstruct your trachea. And the most often than not, we see it often. Friday afternoon, you see patients coming with breathless, the whole place smelling bad odor, and we lose them. And the sad thing is to say that we lost him. So relatives will say, oh, he had toothache, they took the tooth out, his head got swollen and he died. No, he had Ludwig's angina. So the patient probably came with Ludwig's angina. So this is a complication of toothache. So you see the discharging sinuses, you see the fascia, inflammation of the fascia spaces, and that's how the swelling appears. So it blocks the trachea, which lies right here. You become breathless. Your mouth, when they open their mouth, you notice the raised floor of the mouth filled with pus. You get breathless, and then we eventually lose our patients. Oral hygiene instruction, what should I do? It's quite easy. Visit your dentist regularly for just a normal checkup. Clean your mouth. We pick up these incipient lesions as you clean your mouth. Sometimes we feel them, and when we are saying goodbye, we tell you, oh, I feel the cavity. It's fine. Brush your teeth at least twice, 2 times daily. In the morning before you step out, and the last thing before you go to bed. And in doing that, we forget about our kids. Ensure that they do so as well. You teach them how to do it, and then monitor them, especially in the evening. Most often in the morning, you are leaving for work, you are late, but then in the evening, try and guide them through it. Do it for them. Those younger than 10 years, try and do it for them every day. Floss after every brushing, and then brush your tongue. Choose a toothpaste with fluoride. I won't tell you take this toothpaste on. So far as it has fluoride, we are fine. You use a mouthwash. Don't use it as I use the mouthwash. I didn't brush my teeth. And it shouldn't be your regular thing. When you clean your teeth, your dentist will prescribe it for you for like 2 weeks. You just use it for 2 weeks and you are fine. Okay, then hydrate your mouth. This is a very good way to stay clean, to keep good oral hygiene. After taking any sweet, any sugar, use water to just clean your mouth. Use it to clean your mouth. Feel fresh, because so long as the sugar stays on your teeth, you have the bacteria working on it, and then they produce lactic acid, which causes in the tooth decay. So if you rinse it out of your mouth, you don't have any sugar in your mouth, the bacteria stays cool, your teeth is fine, and everyone is happy. Then you eat a lot of fruits and vegetables. It's healthy for the body. Reduce the sugar, the glucose content, the fructose content, and sucrose content in your diet. Take more veggies, and then, as I started with, visit your dentist